Prime Clinic in Namungo, Kampala suburb, is one of the health centers registering a rise in the number of patients turning up with malaria.
These few weeks of January alone, we are at about 36, so that is quite significant mathematically, and almost half of these are severe cases.
Dr. Mulindwa says that malaria has mainly affected young children and pregnant women due to a number of factors.
People tend to lay back when they go to the villages and the mosquitoes are there and all that. So when they come back, that's when we now start noticing the signs and symptoms and the treatments go on.
Malaria is one of the diseases that the country has been battling for a long time, and a large number of resources have been injected into sensitizing the masses on malaria prevention. Since September last year, the Ministry of Health has been monitoring this upsurge in malaria infections, and some of the most affected regions have been found to be Bukedi, Busoga, Lango, West Nile, Acholi, and districts like Kakumiro.
At least for the last 7-8 months, we had like half of the country with abnormal increase of malaria cases.
The increase in infections has also been blamed on changes in climate and increased complacency among members of the public towards preventing malaria.
People, some areas started not using nets because they know malaria had gone down, and complacent. So later on it started going up.
The ministry has now taken on the task of organizing health camps in some of the affected regions where locals will be sensitized on how to prevent malaria.
We do that because the primary prevention, the first line of defense in fighting malaria is at the home level.
This is in addition to stocking all healthcare centers with malaria medication.
First line, second line, and then drugs for severe malaria. But if treatment is done according to our guidelines, then patients improve.
In this effort, 4 pharmaceutical companies have donated medication worth 10 million shillings to the ministry.
We donated the artisan injection. Artisan injection is as per Ministry of Health recommendation, is the first line treatment for severe malaria.
But the ministry has still encouraged Ugandans to play an active role in preventing malaria. Joyce Nakato, NTV Tonight.